Hello, welcome back to our WCSEM Facebook page. I am back today to give you a little bit more insight about our Congress, which is happening in Dublin this November. I'm here with committee member Dr. Frank Fogarty, who's going to fill us in on a little bit more detail. So Frank, this is coming to Dublin. First time this conference was held in Ireland. Why do people want to come to this? What is happening in November that we should get people to Dublin for?
Well, it's a great opportunity for people in Ireland to get exposure to this World Conference on Sports and Exercise Medicine. There's going to be 24 speakers from 4 different continents, 7 different countries. There's going to be something here for everybody. There's going to be GPs speaking, there's going to be physiotherapists, there's going to be 2 ex-Irish Olympians speaking. You're going to get everyone's perspective, from the athletes to the GPs to the physios to experts in their fields. I think there's at least 13 different disciplines being covered, from hip and groin injuries to sports nutrition to even exercise post-oncology patients. So I think there's something here for everybody. It's not about people who are dealing with full-time professional athletes. It's about GPs and physiotherapists and therapists on the ground that are dealing with the ordinary patients we have every day, the obese patient, the patient with diabetes, the patient with cancer, the patient post-cardiac rehab, real patients. So I think there's something here for everyone to take home.
Yeah.
It's very exciting.
And I think because I'm coming from a physiotherapy background, Frank is a GP, we are in the community in Ireland dealing with patients every day that are coming in with different ailments. And when we looked at the setup for this conference, we wanted people to be able to get something out of it that they can bring back to their practices for their patients. And I think it's fair to say that exercise is coming to the forefront of trying to manage a lot of these chronic long-term conditions.
Very much so. I think for a long time we have concentrated in medicine, just on medicine as the sole modality of treatment. I mean, we know for a long time that exercise is pivotally important. Exercise prescription is the buzzword, but do we know what it means?
Yeah.
Do we know how to apply it to children? Do we know how to apply it to somebody who's had a cardiac event?
Yeah.
Do we know how to apply it to people with cancer? We often sometimes in our practice, we often put barriers on people. We often say there's just one way of doing things.
Mm-hmm.
We need to start thinking outside the box, and I think this conference for me is special, and I'm very passionate about it, that it's our chance to realise that sports and exercise medicine, this is about exercise medicine as much as top level sports medicine.
Absolutely.
It's about us empowering our patients with the knowledge that exercise is not a matter of climbing Mount Everest or doing the Tour de France or something. It's about getting out there and walking for half an hour. It's about not stopping your life when you're diagnosed with cancer. It's about getting on with life after you have your cardiac event. So there's something in it for everybody, and I think this is unique in the sense that this is for everybody. Now there'll be something in it if you want to know about the innovations in hip surgery, or innovations in ultrasound, or innovations in anything. I mean, looking at the programme, I think there's everything from hand injuries in Formula 1 drivers to the rehab of GAA players.
Yeah.
So there's something in it for everybody, and hopefully, and that's special. I think a lot of conferences you go to, it's very top heavy, which is great if you have a special interest. I'm a general practitioner, I have an interest in sports and exercise medicine, but I'm not a specialist in it. And I think a conference like this, when I was going 20 years ago, it empowered me to say that what I'm doing as a practitioner and what you're doing as a physio is correct, and maybe the old-fashioned 30 minutes exercise and the old-fashioned life goes on, the can-do rather than the you have to be a top-end athlete before this applies to you.
Yeah.
So I think that's why this conference is so special, and why it's so different to all other conferences.
And I think even the fact that we're both sitting here is an indication of how things are changing. I think nowadays it's about the professionals coming together and working together for the best of their patients. So likewise, conferences that the physios went to would have been very physio based, but in real life in the community we're relying on each other now to get the best for our patients. And we're trying to bring that to this conference. It's about your community practitioners coming together and to try and give them a little bit of something. So even the athletes are in there, but also what we can do on the community for our patients.
Yeah, I mean, exactly what you said, Kira. I mean, it's very much a shared journey. Yeah. None of us have a monopoly in healthcare, and for a long time medicine was compartmentalised. The specialists did their specialisms, the GP did their bit, the physios did their bit. This is about collaboration, this is about working together. This is about, it's the patient's journey with our help.
Yeah.
And I think conferences like this, where everybody works together, and when those boundaries are broken down, I think it's vitally important.
Yeah, and the patient is going to benefit from that.
Very much so.
All the information is at wcsem.org, and you can register now. And if you have any questions that you would like us to answer, then you can get in touch via our Facebook page. Thanks for watching.
Thank you.